I'm Michael Farkouh, and I'm here at the World Congress of Cardiology with the International Academy of Cardiology, Vancouver, British Columbia. I serve as the Peter Munk Chair in Multinational Clinical Trials at the Peter Munk Cardiac Center at the University of Toronto, and I'm here to talk about primary prevention of cardiovascular disease. We are embarking on a large pragmatic clinical trial known as ECAD, which stands for the Eliminate Coronary Artery Disease Trial. And this is on the heels of many important discoveries. First of all, of course, the discovery of the efficacy of statin therapy in reducing cardiovascular events in folks who are at risk for cardiovascular disease, high-risk primary prevention patients. In addition, we found over the years that patients who were randomized into clinical trials of statin therapy enjoyed a legacy effect of the effect of statins, so that even after the 5 years of the clinical trial, those that were initially started on statins enjoyed even a greater benefit in statin therapy than those who were in the placebo group who were subsequently started on statin therapy after the 5 years of the clinical trial. As a result, we have tried to identify now 4 major subgroups that we can identify clinically without any biomarkers, without any imaging or blood biomarkers. These 4 groups are at risk for cardiovascular disease and will not be covered in the pooled equation AHA-ACC guidelines or in the Canadian lipid guidelines. These include patients who are of South Asian ancestry, those with a strong family history of cardiovascular disease, those who are active smokers, and those that have hypertension in the setting of metabolic syndrome or obesity. The trial will enroll approximately 15,000 patients in primary care centers in Canada and Mexico, and it will be an event-driven study of 330 primary events, which include death, all-cause death, cardiovascular death particularly, myocardial infarction, stroke, and coronary revascularization. We'll also have a number of important secondary outcome measures that will be evaluated in the study as well. We hope that this study will help address the issue of when we start statin therapy and focus at our highest risk patients who are not yet eligible for statin therapy. If we look at the pyramid of the epidemiology of any society, the majority of patients are at the bottom of the pyramid, and sometimes because of our inability to do trials effectively, we sort of forget about these patients and don't enroll them in the clinical trials. And as a result, we need to do large pragmatic trials that are of long duration. So this is a trial that's going to take 8 to 10 years to complete. And we have the commitment of our colleagues, both in Canada, Mexico, and worldwide, to undertake this trial.